na ɛhɔ nso ensɛm foforɔ bi aba beto dwa na abusua amanfo bɛkae a enche ye bia be abosomi kakra nie ene beto dwa se recruitment ekoso ewo eye health sector no emu a ye fa midwives ne nurses ahodo ye kiremu a ye biebie portals na ebinumu complaining se eye the health minister Yera Minta Kando wo bie portal no ye portal no bie ne flash otimi bie no 10 minutes na yasa disconnect wo kwa unya hwepo na wakwa apply baby a wo enti a lot of complaints eba mountain so concerning this particular recruitment and someone a free a year health for her eba and no any there two screens so they are more say out of over 53,000 applicants 6,200 nurses and midwives have been successfully being recruited against the 6,500 target Ministry of Health. Into way Australia womo share a year Ghana ya pomudin who ensem so and womo de bomu chirema enipa bako 53,000 ene ko apply say yem post omo enko eye ayaresabia hodo a etwa Ghana fa nan hanum nyina ehia na sa 53,000 abusia de yi omo kra recruit omo nye so medru be 10% kra na se bia 20% just 6,200 per eni eyi womo na sa 6,200 no kra no enfum so kakra e wo ho ana se be ka se ade kakra ama amanfo ka ho asem ne se Ministry of Health na womo hye se enipa be 6,500 eni ye be fa womo out of the 53 applicant no sa 6,500 no kra anso na se 300 a short so eno na amanfo chem se say pa NDC abinde no mpese omo because in the recruitment process of the security agencies what said the Ghana Armed Forces police immigration here there so we saw a similar problem over there ana nipa bebrebu afu senti nipa dodo ye ekoto forms ni ade say yemfa omo nyina ewi ase no de mutumi fa ye ni ene President Mahama ene eye Yera Muntaka yedi gu omuso a ewo krom hanum sei na nya asem ketwa ene de nipa aduru no so Yera ye Minta Akando wono ena sabre de entwabo no adu no so amanfo etwabo ne dendenden se sa ginesi omasini de omunkoye bibi mfa on because adesuafo a omawie nursing school ewo Ghana hanum sei no omo edoso yie pa enti se ye ba be yi kuma bi na ya mo postings a omo maka no omunye den no munni di school no omukoye no omumfa nkoye den eno na I raise a whole lot of conversation ewo internet no eso na so yebeko na yakotie said the health ministry wo mo edisa ensemwe etudwa with regards to the whole recruitment process so ewo health sector no emu yenkombra na yentoa ensem no eso.
So please address this for us. We heard the director say 6,245 people entered the portal. We want a clarification on that one too because the no slot syndrome was real. People went in there and there were no slots. So please, Ministry of Health and all stakeholders, we are appealing to you. Kindly address these concerns for us. Thank you very much.
Good morning, everyone. My name is Dr. Obi Joshua. I'm from the Pharmaceutical Society of Ghana. I'm a pharmacist, and I'm the Employment and Regulatory Lead for the Young Pharmacists. So my question is very simple. I'd like to appreciate the ministry for giving us this opportunity and also opening the platform for pharmacists to apply. But I want to ask this. There's been a good commitment to pharmacy technicians in the free primary health care. I'd like to specifically know from the ministry that what specific quota was given to pharmacists. Because mid-year last year, the Minister of Health made an emphatic statement on the floor of parliament that is going to prioritize about 1,621 pharmacists. It was on the floor of parliament. So out of the clearance for the 8,000 healthcare professionals, what was the specific quota for pharmacists? And moving forward, what will be the specific quota for pharmacists? This is my question. Thank you.
So at this point, I'll invite the head of HTI and also the spokesperson for the Ministry of Health, Mr. Tony Goodman, to answer the questions.
Thank you. The first question, why are we still training? That falls within my purview, so I can answer that. Why are we still training journalists? I'm not sure all journalists have work. Why are we training accountants? I'm not sure they all have work. Education is to liberate you from ignorance. That is the first reason. And then the second one is to get you a job. We have not said that we are not going to recruit nurses. We said we will recruit them as and when we get financial clearance. So we have to continuously train. The other question, I remember the Honorable Minister saying that the volunteers will start from 2022. Nothing has changed. It will still start from 2022. The 2021 batch who were not able to get this particular slot, the next clearance will be part of it. So it's from 2022 and not 2021. So it's still, the plan still stands. So specific quota for pharmacists, even though I know I'll invite the Director, Human Resource for Health Development to answer that.
Yeah, so the quota for pharmacists and pharmacy technicians, I think we've communicated this one. The recent release, I think it was there, is 250. That's the number that we give to pharmacy and pharmacy technicians. But as we also provided additional information that when we are doing the prioritization also, we give the technicians 150 and then we give the pharmacists 100. For the recruitment process, is not ending. As I just said that Honorable is still pushing for us to get another candidate before the end of the year. So pharmacists will be considered. I think what we have planned to do is consistently, whatever you get, you ensure that all professionals are considered. That is our objective. So that one will not change. I think Minister have been saying that even if you get one, you will share for everybody to get some form of it. So that's what we are going to do. And I think I want to add something to what someone asked about the NAC. So we appreciate that the NAC, their numbers were very few. But as I said, this particular recruitment, the objective was for free primary health care. So that's why even usually you realize that registered general nurses, they will have the highest number. But at this point in time, certificate community health nurses got the highest. So it was because of the objective. It's the objective that is driving the numbers that we are picking. But I'm discussing with Ghana Air Service and then Chad to see whether the slot that we have remaining, whether we can reprioritize them for the NAC. Because I actually thought also, I also feel that because their numbers are huge and they were not getting a lot of slots. I think that's it.
So we do another set. Okay. Your name and where you're coming from.
Good morning. Please, my name is Ketri, but when I work for Kesben Media. Of course, the bone of contention here is the low slot syndrome. And we've engaged some of the health professionals, and what they see, some of them are of the view that the portal was a mere formality, and even selection were made beforehand. That is the perception some of them have now. So I want to ask what the ministry is doing to prove, if they have a mechanism to prove that whatever they did was merit-based, so that perception could be cleared, and also the approach the ministry will want to use so that we will not encounter any of such issues in the next cycle of selection. Thank you.
So
upon all the clarifications. So thank you. You didn't do well. All right. Who else, please?
Abusia we enkomotwetwe course so between the health ministry and nsentro for e Ghana kodwe ma said de be ya wo mo ebenya akwanya no ebusebusa nsem a Ghana fo binum ni nurse fo binum ebusa with regards to the recruitment, because oko social media no so Ghana hanom as a whole enkomo ekoso no ebinum twemu ana chese the ministry of health no, they were not genuine with nurses for e Ghana ha, because ohwe nipa dodo o mo afa any nipa dodo a sebe it was expected na as a ensheda entirely sir, but utie the explanations if you're more urban there, all they are trying to say is that this particular recruitment, you know, now womo for the free primary health care, President John Dramani Mahama de aba na no ade ya woko ekopa ho entemano enti according to omo there, that is the reason why omo enya omo for that particular number of nurses rather than the 6,500 ne kra na eye omo ankasa omo target na say target no omo set mo ho no kra no omo entimi emiti that particular target say no, they've picked lesser than the target and amount for them to say is 300 na kano omo nkoye den, and look at it, 53,000 ebusia enya azam ketwa 50 a whole whooping 53,000 omo for omo kra nu 10,000 na ya ka say 43,000 kran ko pe baby ntina 53,000 it was just 6,200 and omo etimi eyi womo anase fa womo a womo aposti womo asabe de womo he say they would also start working at the respective health centers yede ama womo na say no next for na aka no omumpedi omuankasa omubeye de afound. So you could see that the explanations were on and answer for nso ebisemu yie say be omunzo ombehu dia eko na obi a wanti ase no ohu a wetimi ate ase ye, because it will be absurd say obeti say enipa 53 and akọ portal so akọ apply ye da sorry ya na che say mafa 6,200 eja duduo na aka no nei ebinum che say if possible the health ministry should try and widen up the recruitment, you know, because the omo maka wo fie no edoso kra chen enipa dodo a omo afa omo sese enti na me no ka say de ukopie mu ewo the health sector ebusia their ekoso ewo ho eno no a amanfo chem say we de it's very very appalling na say entwa yie enti mprempren mpanimfo nhwe na wo ntena se no wo nwi hu biem so metimi de kakra ka ho a wo emfanka ho na ye nuanom ni bi enso enya ejuma enye enti yebedi akire na ya mamu update e wo sa ensem we ehu now.